name is Daniel Huggins. I am, born and raised in Mississippi. I currently am the Chief Operating Officer for Children's Medical Group here in Mobile, Alabama. We are a pediatric group that service. We have 10 licensed physicians. I've been here for the past going on for 2 years, so going on my third year. Currently, I received my master's at University of Alabama, Birmingham, and I am currently now working on my doctorate of science in healthcare leadership at UAB, University of Alabama, Birmingham. And so, here again, like as you stated, I'm here again to as I used the hashtag and I used it earlier when I went live to be in the know. Hashtag be in the know. I really wish everybody would use that hashtag tonight because that is what I want everybody to do. Regardless, I mean, as you leave here, I want you to be in the know when you go do research on your own to be in the know. And, as you are talking to others each and every day, know what you're talking about and know the knowledge and know the history and background of what you're discussing. So once again, Shalonda, thank you again. I look forward to this segment tonight. I look forward to speaking with everybody and having this platform once again to engage our audience.
That's a good hashtag being the know because a lot of us do not know what's going on for real. So many people thinking that they so far removed because maybe they don't feel like they're an essential worker or they feel like, hey, I can just go about my life and not take this pandemic serious. But I know from seeing you on social media, you definitely have been an advocate of a lot, especially being in the healthcare field, which proposes my first question to you as, being an essential worker on the front line. How do you feel and what's your experience has been like as a health in this healthcare field?
Some will say that in terms of an administrator and being in administration, some looked at it as, hey, you can work remotely, and we're behind the scenes. But there's a lot of things that goes on from a day-to-day operations from a administrative standpoint. So my experience with it, it's for me, it's really more so uh, doing a lot of team building, encouraging those who are on the front line, those nurses, LPNs, technicians, and environmental services teams and dietary team. I mean, just the whole nine. Our physicians, everybody. I use the phrase "circle of life." Everybody that makes healthcare work. So my thing in terms of working, being in that front line, working in healthcare, and being considered an essential worker, it's been quite a journey, been quite an experience. I've actually it's been interesting having to watch life as we know it and as it evolves and changes right before our eyes. Coming into work and not just from a work standpoint, from a family standpoint and just everyday life standpoint, just watching the change and how we are having to, adapt and look at things. And, you hear people ask, hey, excuse me, is this the new normal now? And I don't say it's a new normal. It's a new way of life. And we're just going to have to adapt to that. So being that essential worker, it's more so for me. It's uplifting those who are on the front line, though, because dealing with those patients, it's tough on them. They're tired. It takes an emotional toll. And I really feel from a leadership standpoint that those leaders who are in place from a CEO, COO, CNO, patient experience, patient advocate, whatever your role is on an administration standpoint, I really think now is the time where we really need to be truly engaged with those employees who are on the front line. That to encourage them, help them have avenues and areas for them and platforms, should I say, for them for counseling standpoint to give them outlets, and actually listening to them to figure out what is the challenges that he or she may be facing during this pandemic and during these times.
You touched a little bit on leadership, which goes into what I want to ask you because I feel like so many times healthcare professionals as well as people who are teachers, educators, everybody are still learning from day to day. Like, how do I make this work? Like, so, or how do I keep my faculty staff uplifted and everything like that? So I want to ask you, how have you managed to keep your faculty, your staff calm during the middle of this pandemic from the beginning up until right now, where we are?
Great question. So for me, it was a team approach, and the thing is, as a leader, you can only do so much. You are only as good or as strong as your team. So by listening to them, that's number one, listening. You need to listen to, and once I say be in the know, not just be in the, like I used the hashtag being in the know about this pandemic, but be in the know of what's going on be in the know of what's going on with your staff, be in the know of what's going on with everyone in the organization. So it's how I uplift them is in just through encouragement, knowing what's going on, not just in the facility, but outside of the facility. You have to build that trust level with your team, because it becomes vital and important to know that I can use you as my leader, as an scapegoat, meaning that I can use you as my outlet to talk about things and challenges that I'm facing during this pandemic or during these times inside the facility as well as outside the facility. I've been here in 2021, as we ended 2020 going into 2021. I have used the three words for the staff and for our team, and I told them these are three words that I feel that not only does it work in the facility, but it can work in your home, everyday life, and outside. Those three words are ownership, accountability, and consistency.
Mm,
Taking ownership, accountability, and consistency. I tell the team, if we can manage to do those three things throughout the course of every day, whether in the office or outside of the office, I truly believe and find that you will produce results. And you have to, and you ask, how do I produce results? Is making sure that the things that you're doing, that is measurable, that is measurable, that is sustainable, and that it can be something that can be continuously carried out. And there are other factors that go into that, but for me, it's to keeping them engaged is being in the know of what's going on with them, being engaged of what's happening in the facility as well as in their personal life outside the facility, because they need that escape to be able to vent and just talk. So I feel as in my leaders who are tuned in, who are listening, inspiring leaders. I mean, and you don't even have to have a title to say that you are a leader. It just people are watching you, whether you believe it or know it or not. And the thing is, you need to make sure that that you're engaged with your surroundings, but also be engaged with yourself. Know you, know your capabilities, know what your strengths are, and then take knowing your strengths and executing it and carrying it out, and then being able to open to receive uh, what your strengths are not, so that you can become a stronger leader.
thank you so much for sharing that. You talked about taking care of your team, and giving them great principles to live by. But I'll be curious to know, how have you been taking care of you as a person in leadership and in the healthcare field, being on that front line? How have Daniel been able to take care of himself?
Ooh. Hey, that's a great question, man. That is a good man. Like,
Hey, I'm good with the questions now.
man, yeah, 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 yeah. I mean, honestly, I've been trying my best to do a lot of self care.
Mm,
Um, the pandemic, it took a toll on me from a personal standpoint and emotional standpoint. And I've had my moments in a complete spirit of transparency on here where I did feel like giving up. I did feel like throwing in a towel. It became hard, and because I did not know what it looked like from this standpoint of taking care of me. I became so accustomed and used to taking care of others, helping or trying to help, that I didn't even know what it looked like to take care of Daniel. So, you asked that question, and I'm going to say something that a lot of us as African Americans and people of color that we don't seek. And one outlet that I chose because I needed that guidance was going through therapy, through counseling. Um, I've made it a actual stand-in thing where it was on my schedule every week. It was just, and I talk about how the staff had needed that outlet, but leaders need that outlet as well. You process and we hold so much in. And again, you cannot be effective and you cannot be strong until, unless, you are able to express to somebody. And then because your team needs you. So my thing was, get that outlet of talking to a counselor. What does it look like for Daniel to take care of Daniel? How, give me some exercises of where I think about the movie Bad Boys where I can woosah. So and I have to take steps back to look at, what I'm doing and how I'm doing it. So, I really been doing a lot of, through counseling. Another thing I've been doing a lot of that I found myself doing is a lot of praying. I think, I heard a pastor say, man, that people probably prayed more now than they've ever prayed before. And truthfully, that's the truth for me. I think I pray more now than I've ever prayed before. I pray when I wake up. I'm praying on my way to work. I'm praying at work. I'm praying before I eat. I'm praying on my way from home. I'm praying before I go to the gym. I mean, I'm praying, just for my staff. I'm just continuously in prayer. And my thing that I'm praying for within my prayer, I'm asking God for guidance and peace and just giving me peace and helping me to have peace that surpasses all understanding. And because I know, and the Bible says, in all thy ways, we acknowledge him, that he will direct our path. So I'm acknowledging him, and I'm also, I'm acknowledging to him where I'm lacking. So, that's a great question you asked. And I say to those who are tuned in, who are listening, who are watching, that man, man, prayer. And, and if you don't have, find that person as a leader that you can use and utilize your outlet of venting to, talking about it. Don't carry the burden yourself because, it will become too much. And now during these times, I really truly feel that counseling is needed. And don't be ashamed if you need it. I say it again. Don't be ashamed to if you need counseling. Just because you people say, first thing people think about when they hear that counseling, they think, oh, I'm not crazy. Getting counseling has nothing to do with being crazy. Counseling is needed. Counseling is again it's therapy. It's good for the soul. It's good for rebuilding, to reboost, and to restore, and so that you can replenish yourself. It goes back to my hashtag: be in the know. Know what you're getting yourself into. Know and have knowledge and understanding of it. So I say, if you need counseling, get it. Ask for help. It's okay to ask for help, and it's okay to have that platform and that outlet.
And one of our followers who's listening, tuning in, Shawana Coleman says, therapy is taboo in our community, but it's a must have. We already have trauma from childhood, adulthood, career stressors, etc., and need to unbox that. Thank you as an African male that's also in leadership for using your platform to stress normalizing it. And I have to agree with her on so many levels because most of the time that's one of the things that mostly Black communities we don't talk about the most is mental health and the importance of it, especially coming from a Black man. So I applaud you for even taking the stance to speak up and speak out on how important it is and how much we need it, because not just at a time like this. This is like really, I feel like this pandemic has opened up a lot of layers of things that we did not often see. And now that we're sitting at home, sitting in our homes and working from home, being with our children, being with our families, there's a lot of layers being revealed to us on things that we have to work on in our own personal lives. So again, thank you so much for sharing that knowledge.
No problem. No problem. No problem. Hey, the thing is, man. Again, you mentioned some of what this pandemic has done, and and not just with this pandemic. It really has. It has opened me up, and it just started peeling layers off of me to start for me. I'm gonna be honest, to see my imperfections. This pandemic had a way of putting us to a halt and allowing us to and making us to see ourselves. And it's just been so wow. It's been a wow. WOW factor. Like, wow, this is me. This is who I am. I need help. I need guidance. Where can I seek help? So again, I can't stress enough, because I'm gonna be honest. I was that person. I'm like, man, I don't need no help. I don't do no counseling. I don't want counseling. I mean, I'm good. And what can a counselor tell me, or what can a therapist tell me that I don't already know, that I don't need, and the thing is, it opened up a lot of avenues for me. It opened up places and took me to places and within me that I didn't even know that I experienced hurt, that I didn't even know that were there. So mental health, and having your mental health, it's needed right now. It's a must. People are losing it. People are going insane. People are, oh man, they're falling off the cusp. And getting through this, it's gonna take having a strong mental health, and it's gonna take prayer. And those are the things that I had realized that I do. I had to lean back on what I know. And what I know growing up is praying. We make the joke with my daddy. We say, man, Dad, I got a headache. Let's pray. Daddy, my foot hurt. Let's pray. My back hurt. Like, he wanted to pray. And it's one of the guys, they'll say, well, one of these days you're gonna need prayer. And it's like you're gonna rely on prayer. And at this time, that's what I rely on. I can't speak for nobody else, but that's what I rely on. And I think through prayer is really has what I know through prayer that's what's kept me.
It's funny because when I talk about therapy with my friends all the time, when I first started therapy, I remember saying, like, you mean to tell me I can talk to you about anything and it don't go nowhere? Like,
Right.
therapy was like, oh,
Right.
shoot, I can tell you whatever I want to tell you. And I think people don't understand is that when you're able to release some things off of you, the pressure, the stress, all of
Yes.
those things,
Yeah.
it's like, man, then I can walk out of this room. That 1 hour or 45 minutes, however long people do it, that 1 hour will change your entire life. And especially during a time like this.
Yes.
So I just, like I said,
Yes.
again, I know this wasn't even a topic we were supposed to have about mental health, but I really feel like it still ties into what we're here for, and why
Correct.
we are here,
Correct.
especially during this pandemic. Like, I
Correct.
mean, being inside for our
Correct.
year, it'll be a year, I think, mostly in February, March. I think the world shut down like in March for a lot of people. And so, I mean, I can't imagine
Yeah.
how people are managing with families. I mean, I'm a single person, don't have children, but my heart goes out to those that do. Um, so go
Correct.
into what I really want to know, because I know everybody's curious, because I know a lot of people have gotten the vaccine. A lot of people have not gotten the vaccine. A lot of people are scared of the vaccine, and a lot of people just all totally against it, period. So I want you to dive in and
Correct.
discuss your experience with not taking the vaccine, not only one time, but twice.
Correct. So my experience, so that the vaccine is a two-step process. And just so you know, in the sense of all transparency, Daniel Huggins was totally against the vaccine when it first happened. I was totally against it. It wasn't nothing you can tell me. Even though I knew things, heard things, whatever, I was totally against it. And one thing about me is, if you're against it, I have no problem with it. If it's the thing that you don't want to do, I have no problem with it. I told them earlier when I went live before coming on here, I will not get on here and to persuade you or convince you to take it. I want to put you again in the know, so that when you do talk about this, or when you do talk about the vaccine to people, and people ask you why you're not receiving it, give so that you can actually give a legit answer. And then, and honestly, if it's just to the point of I don't want it, because I just don't want it, I don't want to do it, then leave it, let that be, and leave it there. But for me, um, you talk about why did I take it, and there's a lot of history as it, pertains to vaccine, and we could go all into this. But for me, taking the vaccine, it hit me different when I was exposed, and when I contracted COVID-19, when I had it, when I was diagnosed with it. And I began to immediately. I remember when I was told I tested positive, I was fine. When I started driving down the road, headed home to quarantine, I was fine. And I know immediately the level of anxiety, I feel that's what took me down immediately. So I began to try to go run and work out and do whatever. but it was like it seemed like the room began to get smaller. Things, my chest got tight, and it wasn't even that of the COVID. It was because in the beginning because I played into it because the anxiety of it, I panicked, and it's not to downplay the actual virus. It was like I couldn't become calm because prior to that, me testing positive, I had just lost a friend in Nashville after talking to them. I mean, seeing them, talking to them, excuse me, and on a Friday, and then Saturday we talked Friday night. Then Saturday they died, and didn't even know they had COVID. Didn't even know, and this person is 33 years of age, and didn't even know it. And so for me, I was like, I called my mom, and I said, "Hey, mom, have I ever had any reactions to any vaccines growing up?" And so she told me, she said, "No, you never had any." She said, "Only one of the kids did, and I think she was just allergic or had a reaction to penicillin." And then she said, "But we talked about it, but only the biggest thing she said, me and your dad, we're thinking about it. We're on the fence." And she said, "How do you feel?" I said, "I'm on the fence too, mom, but it's really on me because I know I had COVID. I know that what I went through and what I experienced, I don't want to go through again." And she said, "Son, just pray about it." She said, I'm going to go back to earlier. Pray about it. And the thing is, and I remember saying, whether you take it or don't take it, at the end of the day, God is in control of the situation no matter what. But she just said, but that's something she said, that, but you just truly need to pray about it. And so I did what I did for me. I began to research my history from vaccines for what my mom told me. I called the health department in Mississippi to find out. And I went and looked and I researched my history and I researched my records for my body. And then I did physical. I got all my blood levels checked. I began to become in the know about Daniel Huggins. That's what I did before I took any vaccine. And then so when I took the first round, one of the experiences thing that I had, I just experienced of fever-like symptoms, and I began to get hot. And immediately I called my boss. I said, "Hey, is running fever part of it?" He said, "Yes." He said, "Just take Tylenol, eat you some soup, and just relax." And that's what I did. So Tylenol took every 4 to 6 hours, ate the soup, and I relaxed. I mean, and when I thought more about it, I was like, I really wasn't feeling too hot when I received the vaccine the first time. And so I I got through it, and after which I've had no problems. I take my vitamins every day as I supposed to, and I carried on throughout my process. And during the time that I was waiting before I took the second vaccine, I said I wanted to get some information from honestly from Black men. I didn't even get. I asked some African American women, and I asked others, but I wanted to know. I asked the question in the barbershop, and I asked others, "What are your reservations and things about not taking the vaccine?" And I want to know why. And how I came up with the hashtag of be in the know because they were not in the know. They gave me answers that I like. I know we laughed and see it on social media, like taking the vaccine. Hours later, you turn into this zombie. You do this and you do that. And I
Yeah.
look at that honestly. I laughed and I seen it, but I looked at it as a cop out of you saying because you actually don't have any information as to know what you're actually getting yourself into potentially. So it's your way. I think back into school when we didn't have an answer in school, we didn't know something. We had to be the class clown. We had to do something to draw the attention off of you of not having the knowledge, or you just wanted to say, or just wanted to just do something off the wall. And so the thing was, when I was in that barbershop and I asked, and those ages range from the ages of 19, I wrote it down, ages of 19 to the ages, the oldest one was 69 years of age. And and in there, what I heard the answers about why they didn't want to get the vaccine. Only one that gave me an answer really with some, with some validity and with some substance was the man that was 69 years old. And so then both I stopped the question right there about the vaccine, and I went into this segment. How many of you as Black men have a primary care physician? How
Mm.
many of you as Black? I said because the thing is, let's erase vaccine. Let's talk about, do you even know your health? Do you even know your blood type? Do you
Yeah.
even know what's going on in your body right now? Because the thing is, You could be potentially dying right now and you don't even know it because you have yet to go get a physical. You have yet to get a colonoscopy if you need it. You have yet to go get your prostate checked. You have yet to go even check to do blood work to go check your glucose level. You have done any of that. And the thing is, but yet you see on TV, you hear about a vaccine, and then you want to talk, oh, I'm against that, I'm against that. But it seems as though we're against getting care. But then I delve and I'm gonna go into the second part about my shot. But I really want to put the message out there to us. Then I looked in further and I looked at as far as disparities, and it talked about a poll show Black Americans put far less trust in doctors and hospitals than white people. And it talked about, the reason we don't have trust in our doctors because of some of the things and issues that we face. And it talked about some of the examples that they gave where women had distrust because they went in and one example of a lady, they told her she needed a hysterectomy, and the doctor told her, she said she was bleeding uncontrollably. The doctor told her she didn't need a hysterectomy, and then she ended up going to see a black doctor. And then when the black doctor told her that knew her body, and then she ended up getting the hysterectomy, and the problem stopped. And it talked about in here. It said that slightly more than half, or 50% of Black people said they mostly trust their local hospitals compared to 7 and 10 with the 10 white people. The numbers appear. It said it appears to be getting worse during since the coronavirus pandemic. This is disproportionately sickening, and it's killing the Black people. 7 of 10 of African Americans say the healthcare system treats people unfairly based on race. It says very often, or somewhat, or some often. And it showed a notable increase from 56% since 1999, and it goes forward. This was the study that took place it was done December 20th of 2020. And I understand the things the distrust that we have with healthcare providers. And for me as a leader, I would say to our healthcare providers and also to our health system that in order for us to build this and to gain that trust, we need to look into the healthcare system and figure out how are we to build that trust, and how do we fix and close the gap of disparities, and making our our people as a whole feel comfortable going to see a provider. So for me, and so I go back to talking about at that barbershop and talking to those men that don't even know their numbers. So then all of a sudden you'll get a vaccine shot and then you die or something happens. And then first thing we want to do, it was the vaccine. It was the vaccine. But how would you know it was the vaccine and you ain't been to the doctor within the last year? You ain't been in the last 6 weeks. You ain't been in the last 6 months. And you haven't, and you. So I asked the question: how many of you? My Black men? When is the last time you had a physical? Ladies, when is the last time that you went to the annual yearly? When have you actually checked your body to know what's going on and know you before going to get a vaccine? At least now, before you get the vaccine or don't get it, at least now you're in the know of you. So it starts there. It's bigger than just the vaccine. It starts about you knowing your health restrictions. Have you had any reactions to any vaccines? In the past, in the beginning, what have you been exposed to? What can you take and what can you not take? Daniel, I don't have my mother around. I don't have my father. I mean, your health records are available. You can request your health records. Go to your local health department, go whatever, and request your health records. And then next thing, find you a primary care physician, somebody that you can trust. And it's okay to go in there and sit and talk and ask questions and make that 10-15 minute visit last 30 minutes. I mean, because they're gonna bill you, they're gonna bill on it anyway. They're gonna bill on it anyway. Trust me, I know I see it all day, every day. So the thing is, you use that time to find out what's going on. Ask as many questions as you want to ask. I look at it. We do it with churches. I don't like that church, so I'm gonna go here. I don't like this, so I'm gonna go there. And then you end up somewhere where you feel like you're getting fed. So the thing is, I find you a physician. If you don't like that one, go to the next one. If you don't like that one, but eventually get somewhere, sit down until you get with somebody that you can trust that will help you to educate you on your body. So I say all that. I just received my second round on Friday. And I'm going to tell you, I had somebody comment under my picture because I posted the video, and they said, "Well, I was told that you don't take take any medication or Tylenol." Well, I had one of the physicians and the people to actually recommend it to me, and so I took the two Tylenol fever reducers probably 2 or 3 minutes prior to my shot. And I will tell you that Friday, that week, I had no problems. I mean, Friday I was fine. Saturday I was. I think the only thing in the spirit of transparency, stomach, I said I went to the bathroom a couple of times, but I didn't know if that was because of the cheeseburger I ate or the or the shot. We could easily say, man, that vaccine tore me up. I can't say that because I know I had a cheeseburger and a pizza. You know what I'm saying? So, like, I feel like one of them two weighed more than the vaccine a little bit, but I know it tore my stomach up. But I say I got through that, and honestly, since Friday, I have not had any problems with my second dose. But once again, and what I did though, I took my Tylenol at 9:05. I mean, about 9:02. Then I waited again around 1 to 2 o'clock. I took two more. Then I waited again by 6, 7 o'clock. I took two more. Then I waited again for 4 to 6 hours after that, and I took two more. Then I woke up the next morning and I did my final round, and I never experienced a problem. Different strokes. Now remember, different strokes, different folks. My body is not your body, but but the thing is, but before you do, I'm gonna say because eventually they're gonna start rolling out. Joe Biden is looking, and he's doing this COVID plan to start rolling this vaccine out there. So we want the people of America to start getting it. Now they're removing it from the essential workers or frontline staff. So before it comes, and while you have the opportunity now, go get checked. Go know what's going on with your body and be in the know of what's going on with you. Now, I gave you a lot, but again, it all starts with knowing your body, getting a primary care physician. Forget the vaccine right now. What I found through my research and through my surveys, especially to my Black men, we don't even have primary care physicians. You don't even know your numbers. You can be potentially dying as we speak or have things going on in your body and you don't even know.
That is so
and
true.
So, people, go ahead. I'm sorry.
Oh, no, I'm sorry. So, you just really opened up a whole Pandora's box, Mr. Huggins. I don't think you realize it because it's funny. Right before I got on this live, me and my best friend, we were on the phone, and she was telling me about her, her doctor's visit, right? And this isn't something
right
we just now. I know all the time. We like, girl, it's beginning of the year. We go schedule our doctor appointments at the beginning of the year. Every year, it never fails. Physician, dentist, any type of medical, we do that. And I find it funny that you said that how often do you even inquire about your vital records, your medical records, and anything like that? And I know for me, I've traveled a lot, I've moved a lot, and no matter where I move to, I find me a primary physician. My records, your records, they travel with you. All you have to do is
yes, they do.
Your social security number or your first name or your last name, your birthday, and technology has made everything so accessible. Everything from when I was a kid up until me being right now at 30, it comes up. And it's like there's no excuses. And so I think for me, those conversations need to be had, not just with Black men, but also with Black women. Like we really have to, and I feel like it's who care about your health, because I know for a minute when she said she had a doctor's appointment that day or that day before, I'll call her like, so how did your doctor's appointment go? Because at the end of the day, somebody needs to know something about you who's closer to you. So if something was to happen, hey, well, she did tell me she had, or he did tell me he had X, Y, and Z. So we may think, oh, this person don't care about my health. It's okay to inform people on what's going on with you. And I think for so much, we really have to be in the know of ourselves. So I'm glad you even said that, because so many people who do not know their health disparities, they don't know if they got high cholesterol. They don't know if they have high blood pressure. And it's also something you touched on too that made so much sense, is that you went to a professional. You didn't, we joke about the memes. Don't get me wrong. We all do.
Yeah. Oh, correct.
You decided to say, hey, I'm going to go seek a professional person to tell me X, Y, and Z about this vaccine, X, Y, and Z about my health, so then I can know if my body reacts to something, what's going on with me. And as Black people, sometimes we want to take what one person said or what a conversation has done, and we want to dissect that within ourselves. And it's like, no, we can't do that. We cannot keep ourselves in a position to where we don't educate ourselves on us. And I think that's the most important piece that I know I just took from that conversation that you just did right there.
And the thing is, everything you hit on is so true. And the thing is, I'm gonna say this too to everybody: stop reading the headline, or stop reading the topic or the headline on the article without reading the article.
Exactly.
We see one thing on we see the headline and we take off with it. I told somebody somebody sent me an article when they saw that, I took the second dose. I took video of the second dose. You send me an article of Hank Aaron dies from at the age of 86 years old, and that he died from COVID, receiving the COVID vaccine. Of course, the articles are going to associate the vaccine with his death. But also, just like this article and this thing that I listened to, of talking about these 23 people that died in Norway, one thing they did discuss, it did say now, they said that these people, one, it was a nursing facility. These people were 80 plus years old that died, these 23 people. But also it said, though, and it talked about that they did all majority have underlying symptoms. And yes, potentially that even though that they were dying off, that potentially that vaccine, because it's putting the antibodies into their body and it is acting as COVID, that their body could not adapt and adjust and fight it off as it would have done for somebody of our age or somebody in good health. Now, does that work for everybody, even of our age or younger? No. I'm not going to sit here and say that it does. But the thing is, people see a headline, oh, such and such took the vaccine, a week later he died. The thing is, like, even the professionals don't have all of the answers. Nobody has all of the answers. But my thing is, do you even have the answers about you? I keep going back to that. Before you can even get answers about the COVID-19, or the COVID vaccine, do you even have answers about your health, your body, and what's going on with you? Because honestly, if you potentially go seek knowledge about you, you might find out that they'll say, oh, ma'am or sir, you don't need to get this vaccine because this is the things that your body has experienced in the past. And then you could, I can't get the vaccine due to some of the reactions or some of the things that I faced or done now. And at that moment, if you do decide to take it, then it's up to you at that point. It's because the doctors have given you the information. And then this is the other thing I'm going to go into. Make sure that when you get the information that you're open to receive. Be open to receive, because the thing is, they may not tell you, we go to the doctor and sometimes we don't agree with what they say or we don't want to hear it. I mean, and I understand whether it's good or bad news, whatever the case may be, but and if you want to seek a second opinion, you have every right to do so. But still, wherever you're seeking an opinion from, you still need to be able and open to receive whatever it is, because regardless of what they tell you, they may put you on a health plan. They may put you on something that's going to help you recover or make you become better. So, I go back, I say, man, guys, when y'all seeing these articles, make sure you go read it. Don't just click on it or don't just read the headline. Oh, that's why I'm not getting it. That's why. Go read it. Read what's going on, be in the know of what it's talking about. Then also go back to, I keep saying it again, know what's going on with you. That's number one. Know what's going on with your body.
I got to throw some little politics in here because, we are politics. But no, thank you for sharing.
Go ahead.
I asked, Kimberla, I don't want to pronounce her name wrong, but Miss Little said, Kimberla, I'm sorry. Thank you for correcting me. Kimberla Little says, here in Mississippi, only 15% of the African-American population has been vaccinated, as opposed to 7% of the white population. Thank you for advocating to our community. We need it. I've received the first dose. And Ms. Coleman, of course, said this is an awesome information. And I definitely agree with her. And both of them for sharing their thoughts and ideas and everything they wanted to contribute as we continue the conversation. But I know we started out with this vaccine. I mean, we started out with the pandemic with former President Trump or 45, however people want to label him. And now we're starting a new year with President Joe Biden. And so I want to ask you, do you feel like that if both last year when they found out this disease was in America or in this country, do you feel like there could have been measures then that could have helped us not get to this point, whereas another president is coming in trying to fix what was broken in the previous administration?
And your question is, do I feel what now?
Do you feel like that if we had known, like then, like right when the disease came to America, like if we could have been prevented, like if he had taken the measures that he needed to let American people know what was going on and what was happening, he took the right precautions, do you think we will be right here right now coming into 2021, in another pandemic?
So for me, I always speak from, from a leadership standpoint. And healthcare, we call that what is it, a mass casualty, to be like we prepare ourselves for anything that's catastrophic, that's big, and we go through basically simulations and things of how we actually handle it. I've seen some videos and different things out there where they talked about, where I saw President Obama talk about what we will potentially run into a pandemic. They didn't, and don't, and I don't profess to even be a politician, but I think I remember seeing some things about running into a pandemic, that this day was going to come. And I'm a firm believer of when you fail to prepare, you prepare to fail. I use that phrase for anybody, any leader, any person, whether you're in school, out of school, whatever. When you fail to prepare, you prepare to fail. So I believe that there could have been some initiatives and things put in place where we could have been prepared to, like, I'm not going to say that we would have totally grabbed this bull by the horn and then we would have killed it. But I believe that we could, leaders that were in place and people that were in place could have done a better job of actually, putting processes, I should say, in place, and putting those individuals in place to actually handle this. Those people who are healthcare professionals, who are doctors and different things and scientists and researchers, they are that for a reason. They are those, I call them those, they are professionals within their profession. They went to school for that for a reason. We always use the phrase, so I think we use the phrase to stay in your lane. Stay in your lane, to know what it is that you can tackle, what you can handle, and what it is that this person can handle. I think I watch CNN every morning, and I think I heard Dr. Fauci say that he finally feels good now that he can open up and really talk about what is what, and talk about the actual science and medicine to it without feeling like his job is in jeopardy, or different things. He said there's been times where he's went into meetings and he had to keep his mouth closed because because he didn't want to push back or different things. So I believe that there were some processes, in my personal opinion, on things that could have been done initially that could have slowed this down potentially. Yes, I do.
I appreciate that, and
you prepare for these things. You prepare for these things. You do it at work. You have you have simulations that they do on the job when at a hospital, when you call, like I said, a mass casualty, when you're preparing for a school shooting, when you're preparing for a bombing, when you have all of these, you have an emergency management team that prepare these things. So when it's time to execute and form and to get in place, then it's not everybody running wild like this. It's like, okay, guys, it's a drill. This is what we prepare for. This is what we practice for. And now the real thing is here. Now it's time to wheel it back in. And now let's execute, and let's come to the table, formulate this plan, and let's push it out.
A lot of people outside of the vaccine not want to take it. A lot of people don't want to wear masks. People think it's stupid. People think, I don't want to have nothing on my face, or I can't breathe. And everybody has every excuse in the book as to why they don't want to do a certain thing, when it's not like you are, as a healthcare professional, these things are just made up. Like these these mandates are coming from higher leadership, CDC, and all of this type of thing. So I know President Biden has done a mask mandate. And I just want to ask you, how do you feel about that mask mandate? And you think that it was necessary for him to make that call?
So again, I was that person that was totally, I forget a mask. I'm good because, I work out, I take my vitamins. I mean, as long as I just keep people out my face and away from me, I'll be okay. And you can say that, but how effective is it? Granted, you may say, well, the mask ain't all that effective. It's like we're adults out here, so let's talk about it. It's like wearing a condom. It's 99% effective. You know what I mean? You may have the potential. It don't say 100%. You may have the potential of getting pregnant. You may not. It just depends on if that condom works for you or not. I mean, so it's like that mask. If that mask works, you wear the mask. It's not. It's very much. It's less effective when it's down here. But it's more effective when it's up here. So, I'm sorry you can't breathe. I mean, if you need to take a moment, step away from people, pull your mask down, breathe, and then go back from there. I mean, it is what it is. But I honestly, when you being a person that had COVID, I support the mask. I mean, but I'm not gonna go around telling people, put your mask on, you do what you do, and you do what's best for you. And I know for our employees at work, we require you to wear your mask. No question. If you don't like it, don't work there. I mean, but the thing is, we don't enforce it to our patients. We say we recommend it. But the thing is, people start seeing that people conform to what they see. So you can only tell people so much, and eventually you hope that they conform to start seeing what people wearing masks. If not, then I say have mercy on you, and I just hope that you are doing what you're supposed to do to take care of you. And then if something was happening to you because you didn't wear your mask or whatnot, I didn't see it coming, or I didn't know. Well, did Billy Bob wear his mask? Did he not? I mean, we told him to protect himself. So honestly, with Joe Biden passing that, I'm all for it. I support it 100%. But I'm not gonna go around telling people, get away from me. You don't have your mask on. I can choose if I want you in my space or not.
Yeah, I've seen a whole lot of videos on social media where people are like, oh my gosh, running up to people about their masks, cussing people out, in line. It's really crazy. And you have some people who are precautious, and you have some people who don't care. But I appreciate your transparency and you talking about like how you were against something at first, and then you realize like, okay, let me put myself in another person's shoes, or let me see it from a different light. And you begin to educate yourself. And it's funny because I mean, you come from the healthcare profession, so to hear you even talk about your experiences as to why you didn't want to do certain things, as to like, listen, this was happened to me, and I can't force you to do it, but what I can say is like, hey, these are the outcomes if you do not. And that takes a lot in leadership. It takes a lot of courage
there you go
platform to even say that to people.
Yes.
And those who probably had no clue that you had COVID, or had no clue that you were, against some of these principles and mandates. So I appreciate that, which goes into what I want to ask you. I feel like right now healthcare professions was often overlooked before now. I think people feel like, oh, I'm just gonna go to the doctor, or my doctor's X, Y, and Z. So do you feel like healthcare workers are appreciated now more than ever before, because they are the ones who have, risking their lives every day for people?
Oh yes, most definitely. Healthcare workers are and they're very much so appreciated from every platform. Me as a person coming out of environmental services, which is the housekeeping, I always, and I say because that's near and dear to my heart, because that's where I got my start in healthcare. And those individuals put, yes, nurses do too. Yes, nurses and all these other, they put their life on the line. But these environmental services workers, I think, but they go in and out of patients' rooms, and they're exposed, and it's patients that have such great relationships with the environmental service people than they do with their doctors and their nurses. I can tell you, I know that my environmental services people, when I was working in EVS, they knew what was going on with a patient. It's like a nurse, like, I don't know what's going on. And the environmental service person say, well, I can tell you what's going on because they've spent that much time with them. They, how you say, well, Dave, how does environmental services person, heal through their words of comfort? I've saw where it was patients that didn't even have people to come visit. And the thing is, and you have those EVS people that go in there and they express them, they open up to them, they engage in conversation, and those people, and especially nowadays when we can't even have visitors into the hospital. So you're grateful as a patient to have that person to come see you, and then yes, I do believe that healthcare workers are very much so appreciated, and not just in the hospital setting. I mean, I'd say healthcare from a psychologist, psychiatrist, to a psych tech, to from any platform of just dealing with patients or just dealing with care as a whole. Nursing home facilities, nurse practitioners, LPNs, CRNAs, CNAs. I mean, you name it, they are all so much appreciated now, more so than ever. And I applaud them. Hats off to them. I want to tell them, if I had the opportunity to say to them, keep fighting a good fight, keep pushing. I always say there's light at the end of the tunnel, and I'm always saying there will be glory after this, and this too shall pass. So, man, I just appreciate, dietary facilities management. I appreciate every platform of healthcare as a whole right now. And if they're watching, and if you know somebody, you make sure you let them know that Daniel Huggins appreciates you, and your efforts and your work has not gone unrecognized.
Thank you so much for sharing it. Because I was going to ask you a question, but you kind of tied it all in together. But before we close this thing out, I just want to ask you, what words of encouragement could you give people who are listening, who are skeptical of the vaccine, who are in the healthcare field or not in the healthcare field, but they're still considered essential workers, those who are at home? Just what are some Daniel Huggins nuggets that you can just leave everyone before we close out? Because you have always been a person of good wisdom. Although you still owe me a slice of pizza when you smashed it for me.
Man, hey, it's funny. It's funny. This is a good. Oh, go ahead.
Okay, hold on. Before you answer that question, y'all, I had to end it on a more funny level because we've been serious the whole time. So I met Daniel in college, and I was hungry. And if you went to Jackson State, you know that Legacy closed at a certain time, and that like when food is out, you got to get it. So I was super duper hungry. I had just left the gym. Daniel had just left basketball practice. I sat down to eat. He was sitting next to me. He knew how hungry I was, and he takes his hand and he smashes it in my face.
Hey.
I was so mad, and he ran out. So this is a basketball player. I ain't worked all the time. I ran out the day as if I was a track star. I was super mad.
So y'all, hey, listen, I need at the end of this, everybody cash out $5 so we can get Shalonda a hot and ready pizza. We're gonna replace that pizza. We're gonna take back what the devil stole.
But
I slapped that pizza out your hand. I was trying to save you from something. You know what was in that pizza, girl. Look, I saved your life and you don't even know. You didn't tell me anything.
But no, but I had to say that before we ended or whatever. That was very funny and very humorous, but it's okay. I'm a whole. Next time I see you, whenever I see you in this world, I'm just gonna remember, Dang, you got to go to the pizza shop. But yeah, so just
I'll make sure homecoming I get you a pizza. I'm gonna bring a pizza to the yard. If the yard is open, we have homecoming at Jack State. I'm gonna bring you a pizza to the yard. Now, I ain't gonna bring a box. I'm just gonna bring a slice. That one I'm gonna replace that slice.
Good. Well, yeah. So give us some words of encouragement to close this thing out.
But you opened, that was funny, but you opened up a segue because you talked about the past. And it goes into what I was thinking of all the history and all of what data suggests. And I got all this data right here. It talks about us as Black people and why not receiving vaccine because of it goes back to the Tuskegee, the experiment at Tuskegee with the syphilis and everything like that. And I always remember my mama preaching the message, say sometime before you can move forward, before you can go forward, you got to go back. And then, correct the back and getting that right. And then, but you also got to be able to let the hurt go. I understand that happened once upon a time, and it was beyond our control. This is a new day. Granted, some of the history that is from then is still taken, and it's still present to this day. But one thing that they have, but that you have access to now is knowledge. You have access to care. You have the ability to have access to care. So what do I say? Take advantage of it. Know your history. Know your history of vaccination. Know that vaccines actually started from an African that went around to help other physicians give out vaccines. That started, I think it was with smallpox. Know your history with started with vaccines and where they actually originated from and how it was carried out. You think that it came from white scientists? No, it actually came from I forgot, an African. I think I can't pronounce his name, but Onesimu or something like that. Wansum, or something of that nature. But know that that's where the vaccines and things originally originated from. He helped carry it out. He was the originator, actually showed physicians on how to do it. There is a lot about us within our community, Black community, that we should take pride in, but we don't know about it because we don't research. Know your knowledge. I use the hashtag tonight of be in the know. You have the ability, you have access to care. So use what you have. Oh, Daniel, I don't have insurance. You still have access to care. Well, Daniel, I don't know. You still have access to care. And my thing is this: we sit online and we on Facebook, on Instagram, whatever. But use your internet and use it for good, and go find out about you. Know your family tree, know your history, and then find out about your body. I say tonight to you, we're in a pandemic, where times are changing, and there's a lot going on. People are dying here left and right. Young, old, Black, white, pink, yellow, whatever you want. Death has no respect of person. Death has no respect, and God has no respect of person. Everybody has an expiration date on your head. So my thing is, while you're trying so bad to want to escape from COVID, just remember there are other platforms of death out there. There are other ways in which you can die out there. So when I say keep living, but make sure that my dad had preached. Make sure that when you're living and you're on this earth, make sure you're using you're using your platform and you're using it for good. You're living for good. If you're living for good, man, I'm telling you, access, gain it, go get it. Call your physicians, call your health department, call mother, father, grandma, whoever took you to your visits. Please do yourself justice and go know about your body. Do not cheat yourself and giving yourself the opportunity to live. Do not cheat yourself and treating yourself without, giving your body a chance. Give yourself a chance. Give yourself a chance to live. Give yourself an opportunity to be in the know. Do not cheat yourself out of an opportunity that's available. I look at it, and I'm gonna be quiet after this. I look at it. We always find excuses. We always look for cop outs. We always look for areas in which we can say, well, they made me do. It's their fault. It's their fault. Right now, it's your fault if you don't take this time and this opportunity to know what's going on with you. It's your fault. It's your fault because you didn't utilize this time wisely. So I say to you today, access. You have access to care, to be in the know. Be in the know. Be in the know. Know why you're not going to get the vaccine. Know why you're going to get the vaccine. But be in the know. Do your research. Do your research. Highlight. Read. Study. Study to show thyself approved.
Come on, word.
Know your stuff. Know your stuff. Know your stuff. When you want to be a mechanic, you go study. You know your stuff so you can be a mechanic. When you want to be a doctor, you go study to be a doctor. When you want to be, when you want to be a preacher and want to have the platform to teach your lead, your sheep, your shepherd, what you study. So know your stuff. Read. It's in here.
It's
It's in
fundamental.
here. It's fundamental. It's in here. So thank you again, Shalonda, for giving me the opportunity to talk to everyone. Thank you for those who are still out there who are listening. If you got questions, please hit me up, man. Make sure y'all go follow this Shalonda's page, man. This young lady has done a phenomenal job. I've watched and followed her, whether she knows it or not, and seen some of the things that she's been doing. She's traveled a lot, been a part of a lot of political stances, and I applaud her for it. And she's utilizing her platform to be in the know to help people that look like us. So be in the know. So the thing is, I applaud you, Shalonda, again. Shalonda Spencer, thank you for giving me the opportunity. You are not only just a soror, but man, you're a sister, you're a friend first. Hey guys, please go follow her page and make sure that you watch out for her. I'm telling you, man, the young lady's gonna do big things. So y'all watch out for her. Thank you again. I appreciate you so much.
Thank you so much for sowing that seed. Thank you all so much for tuning in. If you want to catch this and you didn't catch it right now, you can follow us on YouTube at Politics for the Culture on YouTube. You can subscribe to our website at www.politicsfortheculture.com, as well as like our Facebook page. Again, thank you so much, and you all have a good night.